This is an educational video sponsored by Glenmark Pharmaceuticals for the interest of patients, patient relatives and the general public to understand the Intensive Care Unit or ICU, its functions and visitor rules, which will help in optimizing critical care services. A walk into the Intensive Care Unit. The Intensive Care Unit is a dynamic, potentially life-saving environment containing some of the most advanced technology available to doctors, nurses and medical staff. Patients are admitted to the ICU for a variety of reasons: serious illness due to infection and antibiotic resistance, serious accidental injury which needs close monitoring, breathing problems due to lung diseases which require ventilator support, critical conditions such as heart attack or stroke, imbalance in the body fluids and minerals. The length of time the patient may spend in the ICU depends on the disease condition and severity. What is different about the ICU compared to other hospital units? Close observation and monitoring. Patients are connected to machines to monitor their heart, blood pressure and respiratory rate. Impact on family members and friends. A visit to the ICU can be a life-changing experience. The main impact comes from the machinery, the flashing lights and the sound of monitors and ventilators. The patient's family and friends see the ICU staff using this machinery, completing complex patient observation charts and performing life-saving tasks. The patient's relatives must understand the reality that their loved one is depending on life support machines that are being administered. What can one expect as a patient or as a family member of a patient in the ICU? The ICU staff will keep you well informed of any major changes in the patient's condition or procedures that are being performed. You can expect to speak with a doctor on a regular basis. Members of the ICU team meet with the patient and family members to ensure that everyone has a common understanding of the health condition and the plan of care. During these meetings, it is a good time for family members to ask any questions that they may have to the in-charge doctor. When are patients transferred out of the ICU? Sometimes the ICU stay may be extended, which is absolutely on the discretion of the ICU team. Such decisions are taken for the best interest of the patient. When a patient recovers from the critical stage, the patient will be transferred to the next level of care that meets his or her individual medical needs. Entry restrictions to the ICU. The family and friends of the patient in the ICU are usually not allowed to enter the ICU premises unless for a very specific reason. The family waiting area lies just outside the ICU. Though restricted entry may seem rather difficult for family members to accept, there are many reasons for adoption of certain policies and clear definition of rules. Psychological stress for patient due to expression of emotions, interference with the delivery of care, concerns about loved ones. Since an ICU generally involves the accommodation and management of a number of critically ill patients, crowding around is not advisable. Visiting the patient in the ICU. Check with the nurse or the ICU manager or receptionist who will make sure that your loved one is in a condition to see you. Infection control is vitally important because patients are very ill and therefore can pick up infections easily. Visitor limitations. Only one person is allowed into the ICU at a time within the visiting hours. Each person may be allowed to visit only for the designated time as per the hospital policy. The following are not permitted in the ICU: children as visitors under the age of 12 years, food and drinks, flowers, cameras and video recorders, cellular phones. Sitting on the patient's bed is not allowed. While visiting the patient, remain calm and patient. Medical equipment used in the ICU and CT unit have alarm settings to alert the healthcare staff of possible changes in a patient's condition. The alarms are very sensitive to the patient's movements and coughing and may not reflect any real problem. Patient confusion. Due to the medication, surroundings and frequent monitoring by nurses, some patients may experience mild disorientation or confusion while in the ICU. We work hard to decrease or manage this situation and urge the patient's family and friends to maintain a positive approach while talking to the patient. The following are suggestions for family members on how to communicate with a loved one in the ICU. Speak in a calm and clear manner. Acknowledge and recognize any discomfort your loved one may be experiencing. Do not ask the patient questions that cannot be answered. Provide a small board for the patient to write on. Offer short phrases of support and reassurance. Simple hand gestures. Orient your loved one to the surroundings. Spend time with the patient. General suggestions that may be helpful to family members. Always check with the critical care staff before touching anything. Discussing any sensitive or unpleasant matters, since this may deter the critical recovery process. To explain to you what the current status of your loved one is. Any special medication to be refilled. Any additional financial arrangements. If the patient is covered under insurance or reimbursement from corporate companies, there might be some formalities to be processed to avoid any delay in critical treatment arrangement or discharge. Consider setting up a family visitation schedule to spend time at the hospital. This prevents one person from becoming exhausted. Take care of yourself. Your health is important. Rest and relax. Ask for help. Communicate. Ask questions. The environment in which we care for patients and their families is highly technical. We encourage you to ask questions to the authorized representative and remain as positive as possible. The health and safety of patients is our foremost concern and responsibility. Our visitor guidelines are designed to protect the health and safety of ICU patients. We thank you for your cooperation and understanding.